talking, we said, how do we convince solid TCM acupuncturists that this is of value? And this is where this comes to. Not the value part, but whether they'll actually end up using it. And there are answers. I'll give you the historical answer. Historical answer is TCM, as you know it, was based on herbal medicine. And in China, these traditions grew up very distinct from each other. You had an acupuncture art with its own literature, and you had an herbal art with its own literature. And very rarely did one practitioner do the other. Very rarely. Or they might do the other very mediocrely. There were some great doctors who did both, like Li Shizhen and Sun Tzu Miao, were both to be able to do both. But if you look at the Nanjing text, it has nothing to do with herbal medicine. Look at the Shan Han Lung, it has nothing to do with meridian therapy. So the two traditions grew separately. And in the herbal tradition, you know, there was lots of thoughts on it. Stayed pretty focused. The acupuncture tradition was all over the board. You know, every style you can think of. You know, what we know of is Richard Tan and Master Tung. These are very isolated family traditions. That was what China was. It was a gazillion family traditions of how to do acupuncture. Many acupuncturists in the 1930s knew nothing about meridians. They just knew do this point for this problem. So when TCM became institutionalized, which was in 1955, it was organized by Zhou Enlai's wife. It was a different generation. Does anybody here know who Zhou Enlai is? Yeah. He was number 2 after Mao Zedong. Zhou Enlai's wife was the daughter of a TCM doctor, female. Her mother was a TCM doctor. She wanted to be a TCM doctor. Revolution got in the way. She became the wife of Zhou Enlai. She elevated TCM to equality of Western medicine. Now the TCM, they started things. They put herbalists in charge. In the acupuncture spectrum, there was a TCM acupuncture. There was a Nanjing acupuncture. There was a Tong-style acupuncture. Ad infinitum. Well, the TCM herbalists were put in charge. Now, it's much easier to teach a course where the acupuncture corresponds to the herbal. And that's what we have now. It was a very small wing, but exists. In Japan now, there are 25 different schools of acupuncture. One of those is TCM. And that's probably more about what it was like in China in the old days. So the acupuncture tradition we have from TCM was designed by the herbalists. And I'm an herbalist. I totally follow TCM herbal medicine. I don't like compo. I don't get it. I don't value it. But I love TCM herbal because you can totally align it to the patient as they change. You know, in compo, you can't adjust a formula. But I think that TCM acupuncture is less successful than meridian balancing. And I say that from my personal experience. When I came from China, I was gung-ho TCM acupuncture. It hurt patients, and the reason it works in China is they do it 3 times a week. You know, once a week it wasn't holding. I went back to meridian therapy because the Japanese run a system very much like the Americans. It's all out of pocket. And patients can only afford to pay once a week. And they're not allowed to use herbs. So they better get results with their acupuncture. So Japanese acupuncture, when I went back to it, I said, man, this is twice as good as TCM. Why? How do I know that? Because patients got better twice as fast. Needed half as many treatments. And later on, root and branch, okay, I can do TCM. I'm going to balance the meridians, and then I'm going to do TCM. This guy has a weak spleen. I've got to boost his spleen chi. This woman has weak blood. I've got to boost her blood. There's nothing in meridian balance that says how to boost blood other than balance the meridians. But I know, because I've been on both sides of the equation, I can balance the meridians and I can boost chi and blood. I have other tricks. So that's why I say in acupuncture, TCM should be the branch treatment. And you look at a book like Wang and Robertson's book on point treatments. It's wonderful on TCM treatment. So don't want to throw the baby out with the bathwater. I just think that you do this first. what follows is more effective, will last longer, no matter what it is. It could be just a sore shoulder. I don't care what their complaint is. I always balance the channels first. Then I treat the complaint.